instead of us a chat, that would be great. I think that would work, wouldn't it, Ronson?
Yeah. Put your name, title, and organization in the chat, and that'll serve as introductions.
So I think we have a plethora of people today, and I want to get started on time because we're going to go right into family systems discussion as soon as we do the beginning. So I just want to welcome everybody, and the March meeting notes we'll receive and file. But family systems discussion, I think, is going to be a good one, and it might take a while to get through that one. So, Ronson, you want to go ahead and fire that one off?
Yeah. First, I'd like to welcome some familiar faces. One is Grace Farwell, and she's not only a familiar face, but Grace, are you there?
Yes, I'm here. I'll even show my face.
Yay.
Hello.
But so Grace, I think you started this task force, right?
Just about. Actually, I think it was Jennifer Lamarque.
Oh, really? Okay.
Yep.
Okay. But yeah, and then you passed the torch on to me. But welcome back. You know,
Thank
just
you.
tell everyone where you're at now and what you're doing back here.
Well, I am the program coordinator for helping elders live productively.
The traditional wall.
Let me meet some folks.
Yeah, so I'm excited to be back in, kind of in the nonprofit public sector world. So
Great.
it's yeah, it's nice to see so many familiar faces and to see some new ones too.
Yeah, and then Sherry's also back too, which is great for this discussion. So welcome her. And then so we have an important discussion because, as you know, and just talking to people in other spas, this isn't just unique to our spa, but the family system is currently under a lot of stress right now. Seeing a lot of families come in, trying to access and reach services. However, case managers have really full caseloads. So we have some folks online, sort of a panel discussion, if you will, to talk about this issue today.
Alex
let me see.
Join the meeting.
Let me just make sure. Yeah, people muted. If you haven't mute yourself, please do. Unless if you're on the current panel. And then just also a reminder, just go ahead and put your name and organization title in the chat as a form of introduction. But yeah, Lori Ramey of Mental Health America, Los Angeles, and I were discussing this about a couple of weeks ago.
What is he saying? Sorry, I look so ugly in this.
So yeah. And so I invited Tahia Hazlet from Harbor Interfaith, our lead CES coordinator, to have a discussion. And then we have a new face, at least new to me, Nina Takata, is that right? From Family Promise. You want to just quickly introduce yourself?
Sure. Hi, everyone. My name is Lena Takata. I'm the Director of Programs with Family Promise of the South Bay. So we're a smaller nonprofit organization working with families facing housing insecurity in the South Bay area.
Okay. And then Tahia, is it just you from Harbor today? I know Ramon's on and
yeah, actually, I mean, it's a couple of people from Harbor on, but of course in different capacities. And so I'm not sure if Sharon Stewart is on. She is the regional coordinator. I wanted her to talk us through, but also Sherry, I invited Sherry to attend as well, because Sherry, of course, oversaw the system, and Ronson, in a recent communication, there was an email, from Sherry with kind of the direction of the system. So between the two of them, I was thinking we can talk about kind of how the system is impacted our, what the goal is. But what I will share before I turn it over, and I don't see Sharon, so I don't know, Sherry, if you want to start. So, the Harbor and Faith, as you mentioned, oversee the coordinated entry system for families, among other things, but for families is what we're talking about today. So I did want to bring up that St. Margaret Center, Mary Agnes is on, will be taking over for the Inglewood area. So we have, 3 partners, or is it 4? It's St. Margaret Center, and they're new to the family system. But then we also have Catholic Charities, who covers Long Beach, and then who else is it, Sherry? Is that
Family Promise, right?
Family Promise? Yes, Family Promise.
And St. Margaret's is taking over for Path, right?
Correct.
Yeah.
Correct. And so
Okay,
they
great.
just, I think they may still be going through the hiring process, but they have identified some folks. And so we will soon hopefully see the system start to be able to accept more, because we now have a new partner. So of course, in the absence of PATH, the contract started technically July of last year. And so we have not had a northern partner since July of last year. And so Harbor Interfaith have, for the most part, been responsible for not what we do, but also what the partner in the northern area was expected to do.
Okay.
And then also Catholic Charities from Long Beach.
Okay. And then I guess since we're on the topic of the Northern Hub and the different areas, Mary Ines, can you maybe give the group a brief description of your catchment area for St. Margaret Center for the family system?
Yeah, I think it'll be primarily like Inglewood, Lenox, Hawthorne, Gardena, Lawndale. I'm not sure, Jonathan, is there any other cities? I know those are the primary cities.
Yeah, those 4 cities are the primary cities. We've got a few unincorporated areas, right? Lennox, Del Air, Alondra Park, West Athens, Westmont, and that would be it.
Do you guys cover?
Sorry, guys. I'm actually with our new partner at Del Air Baptist Church, literally furnishing the desks for the employees that are starting next week. So,
do you guys cover the harbor area of LA City?
No.
No. Okay. Okay.
So Ronson, before we begin, and actually Sharon's going to jump on now, and Sherry, I'll see if you want to kind of lead. Is there concerns that were raised that we should address as we talk about the family system, or just talk about how it operates in general? So if we can start there.
Yeah. So I got a good sense of the Northern Hub, and then Family Promise. What is your catchment area, or because this will then give the people on the call a better idea of who to contact if they have someone.
Well, we have our main office, or like our headquarters, is located in Torrance. During COVID, we did have families living there, but now we have 2 transitional houses, one in Long Beach, one in Hawthorne. And then our main like shelter site is in San Pedro. But all that to say, we only have 11 spots, so it's not that much capacity for beds. But those are our main cities that we're located in.
Okay. Okay, good. So you don't necessarily have a geographic catchment area, but you're located in these cities, and so but people from the South Bay can contact
I'm in the South Bay
you for help.
and Sherry, so
Yeah, so we service Spa 8, and then I believe primarily with our contract with Harbor Interfaith, we're kind of in like the middle, like Torrance area, since that's technically like our headquarters. But yeah, Spa 8, any of the cities in there is kind of our main service hub.
Okay, great.
And
So,
I think, what may be helpful, and again, I'll let the staff go over the process, how the system is set up. There's actually, and correct me if I'm saying it wrong, Sherry or Sharon, there's 2 FRTs as it stands. So there's one that's housed at Catholic Charities and one that's housed at Harbor Interfaith. And really the process is they go through the FRT, I think, and then get kind of funneled to the area that they're supposed to be in. So like, I know we're trying to identify who covers what area and what agency to call. I don't necessarily know that's, and I see Sharon's on. And Sharon, you can explain to us, we're trying to get an understanding of how people come into the system. And so I was just sharing that there's an FRT at Harbor, and then there's an FRT at Catholic Charities. But those who need to come into the system, do they need to come through the FRT first, or can they go to the agencies directly?
They can actually walk in too.
Okay,
But they're still gonna have to, at some point or another, for their initial screening, meet with the FRT. And Ron, so just so you and the group knows too, we get referrals from all over the place, even sometimes outside of SPA. But the pass-through is, the family source system. They go through the FRT. What we're doing is we're screening to actually verify their homelessness too, because we've had people that were at risk, but they weren't imminently at risk. In other words, they were not going to lose their housing. They were just struggling in the places that they were at. And unfortunately, the way the system, to your point, has been so encumbered with a number of families that are coming through, we've really had to really look at the triage system. And I know last year or the fiscal year before, we were doing things a little bit different, even internally, where each family that comes in can get financial assistance for up to 12 months. However, if hypothetically we had 52 slots and we were keeping folks in for 6 months and then rolling it over, we could actually serve more than the slots we had allotted. What we're finding this year is that we've got people that are needing assistance longer or are staying on that assistance longer. So there's not that, that rollover and that flow through. And I know there's been a lot of conversations even at LASA and from, our elected officials' offices about, what do we do if we encounter a family that's experiencing homelessness, especially those that are living on the streets with children. We can take the call, we can do the triage. But it's even like, for instance, if I would compare it to a shelter, if a shelter has 100 beds and 100 beds are filled, that's what we have. The resources are not there to stretch any further than what they currently are. And I think, when you think about the family system, especially, it does something a little bit different to us as individuals. It pulls at our heartstrings because we're talking about children now too.
Yeah. Actually, that's a good segue, because I wanted to also get to Lori Ramey, who kind of flashed some yellow lights on this issue. And the reason, and I'd like her to kind of paint a picture, because we do have electeds on and city managers and people in our cities who may not be aware of the stress that the family system is having. And I think it's good to kind of to ground this discussion into that. So Lori, you and I were talking about some of the struggles your team were having. You articulated the issues pretty well. Can you go ahead and kind of let them know what you told me about kind of some of the challenges you're facing?
Sure. Yeah, I'd be happy to. So thank you all. I really appreciate all of you from the family system taking your time and coming to talk to us, because I feel like we all need to kind of work together. I totally realize that we are, there's so many families out there. The need is so great. And like you said, Sherry, there's only so many spots. So I want to find a way that we can work together, because I think it's going to take all of us working together and maybe doing things a little bit differently because of the demands on the system right now. One of the things that my team is struggling with, and I think this is not unique to the South Bay or to SPA 8, is that we're set up to work with the adult system. So when we put folks that we encounter into HMIS, we only have access to the adult, to the individual CES. And so what I'd like to do is figure out a way. I know that there's only so many beds, and maybe what we can do and what we have been doing is helping by, helping pay for motels and put families in temporary shelters when there's openings, but kind of bridging the gap. But we need a way to connect people long-term so that they can get connected to permanent housing that's appropriate for families, because we don't have a way to do that. We don't have access to the family CES. So I'm wondering if there's a way that we can somehow bridge that gap, work together, and kind of bring the two systems together, because we are seeing a lot of families out there with minor children. And just like you said, Sherry, we see these little ones out there, and it really does tug at your heartstrings. And we want to be part of the solution, but our hands are kind of tied. So we need maybe some guidance on how we can help people get to the next step. We're more than willing to fill the gaps wherever needed, but we need a way to get people into permanent housing.
Lori, our hands are tied together. And I think, if if you reflect back on a lot of our conversations, even that we've had, it's need outweighing resources. And it's not just the adult system or the family system, it's the youth system as well.
Oh, yeah.
And, I hear you on the motel vouchers. That intervention is extremely cost prohibitive. I can tell you that all 8 of the spas in the family system have gone way above and beyond their budgets. And we're talking about, in some cases, the first 3 months of their fiscal cycle. So it's, and the other part of it too is that we do encounter some families, and I don't want to shame anybody into how they accept or receive services. I don't want to go into a shelter. Only thing I want to do is to go into a hotel. And in those cases, that can be the substitution for crisis housing, but it has to be under the conditions that if a shelter does open up for a family, that they'd be willing to step into that as well.
Right. I agree. Yeah. And I think, all of us struggle with the same issues. I think what's hard for me is when we refer folks, they're being told that, every place is at capacity, which I believe is true. But then what's the next step? We exhaust, them going to DPSS and getting their temporary vouchers and they're, connecting them with benefits. We do all those things that we do, to kind of help that along. But we get stuck at a point of there's no place to go beyond that. So what's the next step? How can we help people at least get in the queue for housing? Just like the adult system, we have folks that are in the queue for housing for over a year or more. But we at least have them in the queue. For us at this point, we can't even get anyone in the queue. So dealing with all the temporary stuff, it's going to come to an end, right? At some point, we need to know what the long-term plan is.
Well, also, you're doing all these things, right? Going to DPSS, and because you don't have access to the family system, all that activity is not being tracked, right?
It's not being tracked properly. It's getting tracked under an individual. And so if they do get matched, to something, it's usually, and we've had this happen where even though we put them in the system, it's not the family system. So they're getting linked to housing resources for places that don't accept children.
So Sharon Stewart is on the phone. Sharon is the regional coordinator, and she can probably talk a little bit to where we are in terms of capacity wise, because as Sherry mentioned earlier, it's only so much, that we can do. But one of the things that I know is where we tend to have the bulk of the dollars, I think, and Sharon can correct me, is kind of like the CalWorks or the Welfare to Work dollars. But of course, they have to be approved by DPSS before they can qualify for those dollars. So there are steps. But Sharon, if you can just kind of go through, I know that we're out of prevention fund, we're out of a few things except for, the grant ends in June, of course, and then we'll start this fiscal year over again. But if you can talk a little bit about that, and then talk about what do we do when we encounter a family and there's no capacity to bring them in, what are the resources that we give? I mean, because we also have motel vouchers, but I'll let Sharon, if you haven't met her, Sharon Stewart oversees the family system.
Hi, good afternoon, everyone. So yes, we are at capacity, which is, unfortunate. We're actually over capacity in a lot of the programs that we use, especially as far as motel vouchers or crisis housing. So what we can do is, we do have, as I said, CalWorks available in rental assistance. So if you are able to voucher somebody or provide immediate shelter over an extended period of time, we would probably be able to provide them with resources or the ability to move them into housing. We just currently can't, right now, we just can't place them anywhere because we are extremely over capacity. I mean, we get families, even today we had probably about 10 families that came in today for immediate shelter that we couldn't assist. And so, what we're trying to do is obviously problem solve because, we can only take in so many. So we are kind of reaching out to family members, friends, whatever resources that the family may have. Maybe they can stay there on a temporary basis until we can bring them in and provide them with shelter. But if they're able to stay somewhere for a period of time and are looking for housing, because obviously the main goal is to get folks into permanent housing. If they're able to find something, then we can definitely look at assisting them with the moving and ongoing financial assistance. We can do that. But at this point, we can only do that if they receive CalWorks.
Right. So at this point, you know, if you have something, an idea, or want to chime in, feel free to do so. I do want to share my screen really quickly because this kind of dovetails into like a kind of a stopgap solution that Sherry and I created last year when we were first seeing some of this capacity constraint. And so what we were telling people in the adult system, not the family system, was that if in an event you come across a family in need of services, call 211 to get, you know, a one-night motel voucher assistance. And then the 211 will then make a referral to the family system. While the family is waiting enrollment, fill out the homeless verification form or find a partner that can do this if you're with a city. Proceed to make sure the family is document ready. Make sure the family is enrolled in, you know, TANF, CalWorks, you know, all the different social safety nets that are out there. And then a resource that's not being widely used right now, even though it's been out for about 2 years now, is to reach out to the family's Medi-Cal provider. And oftentimes, and this is also kind of like not bulletproof because we did like a secret shopper, or at least Kathy tried to do a secret shopper with them and wasn't very successful to get to the right case manager. But they do have case managers at HealthNet, LA Care, and you know, Blue Shield, Blue Cross, these insurance providers, and they can provide housing navigation and other homeless services as well. And additionally, you can still access loss of problem solving and our client aid for financial intervention if needed. But I guess I wanted to go back to Lori's thing, right? So like the family
And
system,
before you go to Lori's, before you go back to Lori's, let me just add that I don't know if everyone's aware that Harbor Interfaith also has 2 family programs. We have a family shelter here in San Pedro, and we also have a transitional housing program, which is always an option as well. A lot of the referrals come through the CES system, but we do take referrals outside of the system. So I just wanted to put that on everyone's radar as well, that we do have 2 family programs that house families while we're looking for permanent housing.
Is that also through Sharon, or is that through someone else?
So it's through Elizabeth, and that's why, and I'll give you Elizabeth Mora Dell is the director of the program.
Yeah.
And so she can take, you know, if you had a family that you came in contact, she can take them directly. And then even, I mean, the idea is not to go outside the system, but then we eventually connect them back to the system, because through Sharon's program, that's who have the financial resources, but we have the beds, you know, as well.
Well, so I want to go back to Lori's original point, though, is that it sounds like the adult system, well, yes, the adult system is pretty busy as well. They're not, they do come across these families, and they do have the capacity to enter these families into the family system, even though that's not necessarily their role. Like, well, they have the capacity to do it. They can't do it right now, right, Lori? That's what you're trying to say.
Yeah, we don't have access to family CES, only individual.
So that seems like a missed opportunity right there, because they have the capacity to do it, but they're just not allowed to do it in the system. Is there any way that they can gain access to the system to then help these families begin that process in the family system?
So is it LASA who needs to give them access? Because how do you have access on the individual side? Who gave you access there?
That's what we were contracted. So, you know, we were contracted under, so our program is part of the MDT. And so we work with the adult system. So I think it depends on what type of program you have. So if you are a program that serves family, then you have access to family CES. You know, if you're a program that works with transitional age youth, then you have access to that. We don't have access to Next Step or the family CES. We only have, so that's the issue for me. And I would love to partner with someone. I mean, we could fill it out on paper form and have somebody put it in. Whatever we could do to bridge that, we're willing to do. Because everything we're doing is a temporary stopgap measure, but there's no way to get them in the queue for an ongoing subsidy or, you know, something that would lead to permanent housing or longer term housing than just a motel or a shelter.
Lori, let me suggest too that you contact HMIS, because as a multidisciplinary team on the street that's not going to just encounter adults only, that's a no-brainer that you should have access to making those internal referrals. I mean, that's what part of what HMIS is designed for, is to make those internal CES referrals. So I would say that's a great place to start. And I hear what you're saying with the paper referrals. I get you. It's
Whatever.
just, yeah, sometimes paper gets slips through the cracks, and
does.
you know, everything else. I think we've had probably every variation of a paper referral that I can care to talk to you about. But I think if you can get with HMIS, because it only makes sense.
I think it's a bigger decision than HMIS, truthfully. I think, you know, that was under the direction of how, you know, HI set up things and, you know, the system. And so it's not just my team, it's across LA County. The MDTs are not really for families, they're for the adult system. So, you know, we cross that line all the time, as well, you know, because we're going to serve.
Lori, that's my favorite thing, is to go into meetings and make noise.
Yeah,
you know, because
so I think it has to go higher than that, is what I'm saying. And maybe I need to start with DHS, because HI contracts with them for the MDTs. So, you know, maybe I can bring it back to DHS leadership.
And I think that's an area too. It's, you know, again, we talk about the system and some of the gaps and how people slip through the cracks. It shouldn't have to be like that, because if you're a homeless provider, you don't know who you're going to encounter that day. And you should be able to get them to the proper doorstep so they can get the services they need. And HMIS is that referral process.
Yeah, and I can say in the past, the system worked pretty well, because we weren't at capacity, right? So we could divert people to the family system, we could divert people to TAY, but now everybody is pretty full. So I feel like, you know, we're willing to help. So we just need to have the ability to do that.
I hear you. I hear you.
So you know, we do have Eric Vargas on. Eric, if you're there, and also Kaylee from CEOHI. And we also have Anissa Lopez from Supervisor Mitchell's office. You know, is this something that maybe they could help bubble up to the powers that be and see if we can temporarily or maybe give access from one system to another? Sherry, do you think that's something they could do? And
absolutely. I mean, you know, I think to your point, Lori, you work under a couple of different contracts, but it's all one big happy family at the end of the day. Coordinated entry system is a collaborative system. So, and you know, unfortunately, I still see DHS and LASA not being the best dance partners when it comes to that process. And I think there's ways that if you have a system that's able to communicate with their system, why aren't we? I mean, why are we still at that place? If that makes sense.
Hey, Eric, I see you turned your video on. It's seeing you. So yeah, I mean, we're wondering then if you can take this up the ladder at LASA, and that, you know, we have some capacity in the adult system, especially in our multidisciplinary teams, and they need access to the family system to do the referrals and do some of the basic kind of groundwork, you know, getting, you know, general relief, you know, DPSS, TANF, things like that. Is that something you can kind of run up the ladder and see if, you know, something can be done about it in a kind of emergency crisis timeline?
Yes, I'll definitely be bringing it up. I'm actually writing a report about this meeting, and we'll have a check with my supervisor. So I'll definitely bring it up, and then please feel free to connect with me offline if you want me to bring something specific up, so that I can help set up a meeting with the folks who are will be able to make this happen.
Cool. Thanks, Eric. Ramon, you had your hand raised, and then Shannon Murray had a question in the chat too. Ramon?
Yes. Ramon here, the city's coordinator. So I know a lot of my staff happens to run into a lot of the families, homeless families. And the direction that we've, so we're able to like conduct some sort of like family CES screening, I see that like we're able to have access on that. I mean, obviously it's not our job to do so. Like the protocol that I give my staff is just to email the family system, you know, like obviously I know like call DPSS, make sure the family is all like document ready, and then send the file over to Sharon's team. That's the best way to do it because, you know, like Sherry and Sharon were saying, like, you know, they have, you know, a caseload. We all are inundated with people who are experiencing homelessness, but we are able to do that screening also. And I've trained my staff to do that. You know, like obviously call 211, work that out with DPSS and stuff, but the resources are just so limited. You know what I mean? And I know that the family system is doing all that they can to help SPA-wide, you know, the family get the shelter and housing navigation and stuff like that. So I'm not sure what else can be done, you know, at this point, if we're doing everything that we can do at this point.
Okay. So you're saying, Ramon, that you do currently refer people into the family system when you have the opportunity to?
Yes, definitely. Like I know our Manhattan Beach outreach worker has worked with a family for a year maybe. You know, she has younger children and stuff like that, and she has been in and out of the system. But then there's two of the kids have aged out into the TAY system, which we also work with. We also work with TAYs as adult individuals. But yeah, it's like if I open my CES right now, I'm able to like enroll them into the CES family system. And so if I'm not mistaken, I believe Sharon does a CES family packet via paper, correct, Sharon?
Yeah, so we do a screening tool, we do an FSC entry point enrollment, we do the BIS for that. So they are the three main things that go into HMIS initially, and you know, families can be matched to a resource, obviously based off of the SPDAT. So, I mean, if there is a way to input that information, as long as there's a point of contact put down, as well as maybe a CES staff member, that would, you know, with that information being in there, won't prohibit the family being matched to a resource if they meet the criteria.
So, like, I guess, Ramon, you seem to be able to do it, but I wonder, I want to open it up. Dulce, does your team have access to the family system, or Madeline? Because you guys are traditionally more adult focused, right?
Hi, this is Madeline. I do not have access to it on my end, and probably Dulce, maybe since she's with Hawthorne now, but I don't think anyone from our agency has it at this time.
Okay. Sharon's question, and then we'll get to Pastor Jefferson. Does Harbor Interfaith do the matching for families? And is there a weekly or monthly call where the family system is discussed and coordinated in SPA 8?
So for families in SPA 8, there's really a lot of resources for that. And so we don't have a case conferencing call for matching. What normally happens is LASA reaches out to us and they say, oh, we have this resource coming up. Do you have any clients that fit this criteria? And then at that point, we reach out to all of our partner agencies and review our own caseloads to see if anybody does meet that criteria. Because we don't get those calls that often, we don't have a regular case conferencing call for those.
Okay. And then Kaylee mentioned that she's going to bring this back to CEOHI. Thank you, Kaylee. That would be super helpful. And let us know if there's anything the CEO's office can do too. And then Janet was saying that sounds like Kellyanne can help. Yes, and then of course, one of the things is that our case managers don't have a habit of using that resource yet. And it's something we need to figure out how to train that into our case managers better. I still get a lot of calls, even from our veteran case managers, like, oh yeah, I didn't think to do that. But we actually have on this task force, Kelly, case managers. Yvonne, is Yvonne on, Kathy? I know it sounded like she was
Hi.
with a case.
Hi, this is Yvonne. Can you hear me?
Yeah, hi, Yvonne.
Hi, I just had a family with a 6-year-old, a 3-year-old, and a 4-month-old walk through the office 20 minutes ago, unhoused, been living in a car, and has to give the car back today. I apologize for being late for the meeting. That's what I'm
You want to just let
working on
people
right
know
now.
who you are and what you do?
Hi, I'm Yvonne. I'm a community coordinator, health advocate with Blue Shield Promise Medi-Cal program.
Great. And so you are a ECM case manager, right?
Yep.
Yeah. And so
And
you
I
can
work
help
out
with
of
housing
the,
navigation.
yep.
Yeah.
And
okay.
I work out of the Wilmington Community Resource Center that Blue Shield Promise Medi-Cal is in partnership with LA Care. And we have 14 resource centers in Los Angeles County. And I work out of the one in Wilmington, SPA 8.
Great. Great. Yeah. And so one of the things we're trying to do at the COG is to try to get folks like Yvonne more connected to our care coordination, at least on the adult side. And it sounds like from Shannon's question, it might be beneficial to do one on the family side as well. Yvonne, did you have anything else to add, or you want to say like what resources you can provide from your side of things?
Sure, Ronson, thank you so much. Anybody who is on Medi-Cal, they can call the phone number on the back of their card. We can link them to any mental health resources, OB, dental, eye care. We have a direct liaison at all 14 of our resource centers. They are welcome to walk into our Wilmington Service Planning Area 8 Resource Center, and we can help them with case management and navigation. On all of these services are free. And we also have cooking classes, healthy cooking classes, exercise classes, CPR classes, everything free for the community here. And
you have HMIS access, right?
Yes, we just hired somebody.
Okay. And then do you have family system access? Or like how does your access work?
I am directly referred cases, or community members walk directly into our resource center, or I'm directly referred cases from our social service team through Blue Shield Medi-Cal.
Okay. And then do you input those people that walk into HMIS?
Yes.
Okay. What if they're like a family, like in that instance, you're able to input that as a family in HMIS?
I personally send that over to the housing navigator with Blue Shield Medi-Cal that has that access, and I send that information directly over to them.
Tahia and Sherry, do you guys have a good understanding of how Yvonne's process works and how that works within the CES system?
I'm familiar with CalAIMS through the DHS system, not so much with families. And I think the question that came up in my mind, Yvonne, is if a family comes in and they have no means of housing for the night, are you guys able to put them up somewhere?
That's a great question, and that's what I'm dealing with right now. And right now, I do not have that resource.
Yeah.
Right now, right this moment, this client just walked in 20 minutes ago, and I'm working on it.
Yeah, we've done some client A cases for Yvonne at the COG. Yeah, but I'm just trying to like I feel like these CalAIM folks like Yvonne, they're kind of operating like, I don't know how you would characterize them outside the system, and it's just like this kind of weird thing right now where they're not fully incorporated into the system yet.
And Ronson, I think just to add to it, it seems like part of what spurred this conversation was that immediate front end crisis. We find families sleeping in cars or, on the streets or whatever. And what do we do at those times? And that's where the front door has a problem to the system because, you know, we've expanded so much for the single adult system, even expanded recuperative care, but the family system, as far as family shelters, hasn't grown. You know, we've got a handful of units over in Long Beach, you know, through at Century Villages that Catholic Charities oversees. We've got, you know, our 21 units at Harbor Interfaith. Family Promise has, you know, their few units that they're able to do. It doesn't support the flow that's coming through the front door. And I think this is, you know, again, where advocacy to our elected officials and even our funders to say, we need more family shelters, you know, for a couple of reasons. Hotels just cost too doggone much. And the other is that the need is dictating it.
Yeah. Yeah. We may even need some emergency family shelters. Okay. Yeah, I will definitely, like the COG will try to do its role to kind of bring this up in our steering and board meetings coming up in May and having those conversations with our electeds for sure. Hey, Pastor Jefferson, I know you had your hands up for a while. I want to go to you. Jefferson? Yeah.
Hey, Ross, can you hear me?
Yeah.
Jonathan from St. Margaret's. I have the call on my phone, so I don't want any feedback. But I just wanted to clarify. I wanted to clarify what you were asking. You know, boots on the ground workers who are attempting to help families who may be only contracted for single adults or TAY. That you're asking about access to the CES, and Sherry touched on it via HMIS, not necessarily the paper referrals that Ramon was referring to. Am I understanding that correctly? I'm trying to
Yeah, it's not like we need like a
HMIS
referral process from like having an adult, some of an adult system access, being able to refer a family in the family system.
Yeah, to me, I'm hearing, well, and all the homeless services providers will get this, and I'm trying to share this with the folks who might not be working in homeless services on this call. I think what we're getting at is, why can't some of the outreach workers press the same buttons in the software that other people are pressing? And by virtue of that, and Sherry's smiling, and I know she knows exactly what I'm talking about. It goes right back to the front door problem, guys. How do we get them onto community queue? Okay, which is essentially this wait list. And then even someone spoke about theoretically getting someone a housing resource, even if let's say a adult outreach worker does all the right things, uploads everything they need to put into HMIS, and gets a match that isn't always available for them. You know, that's a long shot, you know, and that's not something that they get onto a wait list with any meaningful end time. So, you know, these are challenges, but it still doesn't speak to what Sherry was talking about, a front door issue. You know, imagine all these outreach workers pressing this button because that's all it is. It's a button, and they just sit there because of the volume. And Ramon spoke about having access to it because he has Harbor Interfaith access. We have access to it. You know, Madeline mentioned we don't have access. We don't have practical access. Like we can put them into this system, but it's not going to go anywhere unless it goes to the programming that's already set up by the CES leads, including Lawson.
Right. So just in layman's terms, regular outreach workers can't even put people on the wait list. So it's like,
yeah,
they can't do that first step. Yeah. Okay, great. Any other comments, ideas, questions from the group? Okay, well, we have some takeaways. So, you know, our partners from LASA and CEO's office will kind of bring this up the ladder. You know, the main thing is to see if there's a way we can allow regular outreach workers to access the family system to get people on the wait list. At Harbor Interfaith, there's programs outside of the CES system that Elizabeth Dale helps with, and we can maybe get connected to her. We have also case managers at our insurance providers. While they don't have access to shelters necessarily, they can sort of begin that problem solving process, and also gives a family someone to talk to, like a warm body to talk to, right? And that sometimes that helps tremendously versus facing another wrong door, right? So those are kind of the 3 takeaways on this discussion. Am I missing anything? Okay.
And what I think, and also Dan from Harvard has his hand up.
Oh, hey, Dan.
St. Margaret Center is starting their families program soon. And we'll get back to you guys when we get that going. Thanks, Harbor Interfaith.
Yeah, I just wanted to point out for the CES adults anyway, we have the Access Center, which is a walk-in center where we can do referrals, we can do services, you know, we can do problem solving, and it doesn't seem that I know the family system has kind of the same thing, but they don't have a per se Access Center contract. They use CES entry point, which is like a services only, just kind of way to get someone into the system. But it does, you know, from my viewpoint, the systems don't seem to be very equitable. For instance, some things are available to the families that are not available to the adults, you know, because of children, et cetera. That's understandable. But then some things that are available to adults are more streamlined in terms of the adults than it is for the families. I'm just curious why there's such a dichotomy, why that should exist in that way. For instance, I have access to family, you know, to family stuff, family programs, family targeting tools and assessments and all that stuff, which I have no need for. But I don't see any way in there to refer a family, were I to try to do it, to refer a family, say, to a shelter or to the community queue for any kind of shelter. I don't know if that's just because I'm, you know, I have a CES adults program, or is it because it doesn't exist? Is there an interim housing program equivalent to CES adults for families?
No, there really isn't. You know, obviously Sherry mentioned the shelter beds that we have, but we don't have, it doesn't run like the adult system. So, you know, the adult system, they go into a shelter and then they go into housing navigation, then TLS. We work similarly, but it's not based on someone being in the shelter. So we could bring somebody in, you know, from another, you know, area that's been staying with somebody or just recently became homeless, and they don't need to be referred from the shelter in order to get housing navigation or TLS. So it works similarly, but not exactly the same as the adult system.
Right, and that's what I was referring to, the inequities where some things are available to family. For instance, that streamlined process to getting somebody into a housing search and placement program, such as TLS, housing navigation.
But the way it's set up, I mean, it probably couldn't work the same because we only have 24 slots for crisis housing, 24. And right now we're at probably about 35. So we're already over capacity just because families do pull up my heartstrings. I mean, every time a family comes in, you know, and they've got someone's just given birth to a child, you know, even though I shouldn't bring that family in because we are over capacity, I bring them in. So I'm already over capacity, and we can only do so much. And again, so getting assistance from the other community partners, if they can, you know, provide some kind of immediate shelter, even if it's on a temporary basis, would help us out tremendously. I mean, we can help with the housing search. We can help with the financial assistance once they find somewhere. It's just that immediate shelter that we're struggling with.
Yeah, that's what I'm referring to. I don't know, that's a big problem.
Yeah.
This is Pastor John. Yvonne. So the family that you have with the 6 folk that need to get housing for the night. So if you're not able to utilize your services to get them into shelter, call me here at the church, and then we'll be able to assist you with that. So we have stuff here because we get a lot of families that come to our church, and we try to get them into the system. And sometimes we have to be able to connect them to somebody. And we utilize Dolce a lot here at in Hawthorne. And now we're finding families that are coming from other cities to coming to our church, trying to get help with housing and getting in temporary shelters. I don't know how, y'all must put our name out there everywhere, because we're finding ourselves putting families up for the weekend and putting up for a night and all of these things here. We've been blessed and fortunate to have some funds set aside to be able to do that, but I need to be wise in doing that so that I don't deplete all of those funds. So, I'm being kind of selfish with them. So we're here to help, but we have to know that we have true partnership going both ways.
And that's what we're here to prove, right, Pastor? That's what we're here to prove. It's going to be awesome.
Thank you for that, Pastor Jefferson.
Thank you, Pastor. I pinged you in the chat. Thank you very, very much. And I am more than willing and happy to support any of your members in any services that I can provide on the Medi-Cal half.
Lori?
Yeah, I just wanted to loop back. So if we have a family and we've put them into, some type of temporary housing or shelter, and then we want to get them connected to you, Sharon, for that housing and navigation part that you were talking about, what is the best way for us to do that?
Well, I think the best way really would be to reach out to me directly. I mean, I think it may even be a good idea to have, the members that are on this call, if they're willing to do maybe a weekly case conferencing with any families that they do have, that we can discuss, the best, path forward. I think that would be ideal. It may not need to be once a week. I mean, maybe we can start off like that and then see how it goes. But it seems like a lot of community organizations are on this call that I'm not familiar with, and what you do and how you do it, and what families you're coming in contact with. So I think it would be a good idea if we do hold some kind of regular meeting where we can discuss the families that you have. But for this particular family, if you're working with one right now, go ahead and send me their information, and we can talk about it offline.
Sounds great.
Would a weekly family, does everyone agree like a weekly family call might be worthwhile?
I do, because I think every situation is different. And like Sharon said, it may not need to be that frequent always, but maybe to start off, we start there, and then maybe we meet like every other week or once a month, just to kind of touch base, because every situation is a little bit different. And I feel like I have access to resources that might be able to help bridge that gap a little bit. And if we could partner, I think we could really effectually help, more families. So I would love to do that.
Okay, great. Hey, Kathy, why don't you and I talk? Maybe we can help set that up. I think also, Cliff Gardner just put in his contact info. And Pastor, Jefferson was very helpful. And I'm sure there's other churches as well that can maybe help. And so I wonder, Cliff, if we have like.
I'm good, man. Not too bad. Let me lower this meeting real quick. Hold on.
Oh, I think that's One. Sounds like One.
Sorry about that.
Yeah, it's okay. Hey, One. So Cliff, I wonder if like you might be able to leverage maybe your faith-based contacts, to see if there's any capacity for our churches to help out as well with families.
Sure, I would be happy to. Would you like me maybe to put together a list to send out, or?
I'm not sure actually. Maybe what we do is invite you to our first family kind of care coordination, and then we can discuss maybe the best way we can approach the faith community.
To send the information out. Sure, I'd be happy to.
Yeah. Kathy, your hand raised. Oh, you're on mute.
Am I unmuted now?
Yeah.
Am I good? Okay. Sorry about that. Before you were mentioning that we could do direct referrals to Elizabeth at the family shelter, I never knew we could do that. I always thought everything had to go through the regular intake process. I'm shocked to
He is
hear
talking
that.
about the transitional.
Yeah.
The all program.
No, not the all program, just the regular shelter on 10th Street.
Right.
21 beds.
Have families for the shelter because CS is impacted. So you heard it directly from me. You can call Elizabeth directly. So the great thing is Harbor Interfaith oversee all of the programs. And so we'll take a look internally at our resources and make sure that we're following whatever the process is.
Awesome. Thank you, Tahia. And we'll be able to send, we'll just try to send out all these resources and contacts in the meeting notes too, so people can have it. Dulce?
Yes, hi everyone. I just wanted to I know I'm preaching to the choir. I've heard everyone on this call in this meeting. We share the same frustrations, and I know all of us are working extremely hard to communicate with one another and try and place our families and individual adults. But I will tell you that I am seeing a rise in families. I work extremely close with Pastor Jefferson at Del Air. I am thrilled to see the St. Margaret is taking this family contract on because it's definitely going to alleviate my stress. But I want clarification on the referral process on the CES system. So do we continue to fill out the referral to family solution centers form that appears on the LASA document? Because I keep doing it. I send it to the Valley Oasis, to Pat, to the Whole Child, to the family, all of them, all the access centers. But I will be honest, and I don't want anyone to get offended, but the only two agencies that tend to reply within 48 hours, sometimes, not all the time, is Hopix and sometimes Harbor Interfaith. So I want to make sure that should we continue to use this referral form, or do we just call directly? And the only reason why I'm saying that is because it breaks my heart sometimes. I have no place to place these families. And the minute I tell them call 211, I feel like some of them want to beat me up because they said, no, 211 is not working. They don't answer. They don't return the call. And then I have to call Pastor John and say, Pastor, I'm doing everything that I possibly can to find a solution for this. So I just want to make sure that we as case managers in every agency, is it helpful for us to continue and complete this referral form and send it to these agencies the way we've been doing? Or should we just continue to call, the individuals directly, like Sharon Stewart and?
No, continue to send your referrals to the FSC email address.
Okay.
Because they are first of all, you should be receiving an automatic email once you do send it there. But all the calls are logged. The FRT and the receptionist, they call them back hopefully within the next couple of days. Even if it's to tell them that we're at capacity and provide other resources, or to help with problem solving. So definitely continue to send it to that email address. Now, if you send it and the client says that they haven't received anything, or no notification from Harbor Interfaith, feel free to reach out to me and I will definitely look into it.
Thank you. And I know, once again, all of us are working really hard, and I know you're probably bombarded, but I just wanted to share that, you know, vent a little, because the frustration is definitely there. And, you know, I just wanted to
and I can definitely understand that. And even while we've been on this call, that email has received 15 referrals. So you can imagine we are seeing a lot more families than we did in prior years, and it's ever increasing.
Yes, it is. Thank you. I appreciate it.
All right. Looks like Kaylee might have notified her partners at CEA. We got Marco and then I think One was on for a minute. Yeah, so I know, Marco, if Kaylee brought you up to speed, but there was like an ask that we're having Eric Vargas bring up to LASA, and then maybe if you guys can also raise that CEO that you know, there is an opportunity for people in the adult system to contribute in the family system, because there is more capacity in the adult system, but they don't have access, so they can't even put people on the waiting list in the family system. And so we're wondering if something can be done in the system itself to allow for that access. And then I don't know if you have anything else to share as well. Go ahead, Marco.
Yeah, thanks everyone. So hey everyone, my name is Marco Santana. I'm a team member at the LA County's Chief Executive Office of Homeless Initiatives. I was actually at the dentist, and so they tagged in for me while I was coming back, and then I came back and they tagged out. But they did mention, Ronson, I'm happy to start an email chain we have a team specifically dedicated to the family programs. And then another team dedicated to TLS and housing navigation capacity as well. So I'm happy to start email threads with the respective parties so we can address some of this. I will say too, just, you know I jumped in a little later. I served as a director at LA Family Housing, which is the lead homeless nonprofit in SPA 2. And I oversaw the Access Center for families and individuals. And like, I know, I would see Sharon on some of the calls that we'd be on and everything. And the system is most definitely impacted. And I worked with a team directly that was both placing families and then had to eventually start turning families away from shelter, not so much because they were not eligible or anything, but because there was nothing available to them, very unfortunately and sadly. So I'm very familiar with kind of the concerns you all are raising. I know it's extremely difficult to see a family with minor children and have to tell them, hey, I'm sorry, there's nothing we could do, right? Like 211, unfortunately, is the best option. Connecting to DPSS if they're eligible is the best option. But outside of that, there's not a whole lot. And I did want to share too, Lutza, one of the other things too, because I oversaw the email referral as part of my purview, is that, as Sharon mentioned, them getting 15 emails just while being on this call. A lot of times my teams would be more focused on providing case management to the referrals once they came in, that we might sometimes didn't always respond saying received. We did have an automatic email, but a lot of times folks want reassurance, but we would move to like, okay, we need a triage, focus on the families that are here. But going back to it all, Ronson, I'm happy to start an email. If you since I joined a little bit later, if you want to send me a quick note on what all might be the better question, and then I can connect to you with, for sure, Leticia from our team. She oversees family programs, and then see who else might be necessary to include.
Okay, great. Yeah, and then Jonathan and Lori, if I can include you and whomever else on that discussion thread, that would be great too, since you guys are more of subject matter experts and boots on the ground than I am. Cool. Awesome. Thanks, Marco. Appreciate that. And I think, and I guess Shannon. So I think we should move on. We're running a little late now, but thank you everyone for that great discussion. And hopefully we can see some change and open up some capacity to the families that we're seeing. All right.
Thanks, Ronson. And you know what? Going over on this one was it's good discussion and great brainstorming. So it's well worth the extra time because there was a lot of input, and I'm sure that with your help and everybody else getting together, I think we could probably come up with some good ideas for families. So we will move on, and thank you, everybody. At this time, I'm going to let Keenan Leary from COG is going to talk about time-limited subsidy. Go ahead, Keenan.
Yeah. Thanks, Rodney. This has been great conversation, and yeah, I'm excited to see the family systems work group that comes out of this. Speaking of TLS, the COG just got our MOU for providers approved for our TLS reimbursement program. So I'm going to be talking about that today, just briefly. I know for a lot of our providers, they already have a lot of this context. They know how TLS works. But just want to go over it again for all of you, because this is going to be an opportunity to expand your existing TLS programs by getting reimbursement from the COG. So kind of like we do with client aid, we see a gap here where TLS is a very effective way to get people permanently housed for a proportion of our population. So yeah, I'm going to be going over that a little bit here. And we initially voted to approve this funding expansion of local solutions Measure H funds in February, but what was just voted and approved was the actual MOU contract we're going to be distributing with providers. So formerly known as rapid rehousing, this is just kind of a basic overview of how TLS works. So it's basically like a rental subsidy that's typically seen as a 1-year phase out. The exact amount of subsidy is different based on each individual, their housing plan, and you know how quickly they can get economically self-sufficient. But in this case, we'd be just reimbursing an existing TLS program of one of our providers that provides move-in deposits and rent subsidy, and then over the course of 3-month intervals evaluates whether that rent subsidy can decrease as the individual becomes economically self-sufficient. And we want to be targeted with this. We see this just as another tool in the toolkit of different housing support options that we have. We know that almost half of our population actually doesn't identify as having a significant mental health or substance abuse problem, and really are struggling on the streets because they're in deep poverty. This population is oftentimes overlooked in the permanent housing supports system. These folks might have an acuity score of 0 to 8 on the VS-FIDAT, or a priority score of 3 to 4 as a result. So they're not likely to get a permanent supportive housing placement anytime soon. But we believe TLS is an important intervention here because they have an ability to self-resolve with that medium-term poverty alleviation to get them back on their feet with that 1-year rental subsidy. And also, I just want to say with this program, we want to really prioritize innovation in housing placements. For instance, I create this housing dashboard that I send out every Monday, and there's a lot of placements on there that we could be great slots for people, but just don't necessarily fit either the existing income that people have, or might not be the best spot for a voucher based on the existing voucher supply that we have. So for instance, photos of this unit on the right are a brand new carport ADU that was added to a complex in Gardena of a landlord we have a partnership with. It's a 2-bedroom unit. They're sending it to us first because they want to know if any of our clients, are able to move in. And it would be an affordable listing. But A, we probably don't have anybody who has a LACTA voucher right now on the street that they could use to move in here. And B, it would probably be too expensive of a unit on their own for a family or a couple to move into who's at the income level we normally see. So this is where we want to innovate. We want to make sure that we have TLS supports for people and allow these partnerships with these landlords that we have to continue to be fruitful.
Yeah, I just want to add that Keenan's done a great job of finding these landlords. I wish we had Keenan during EHV, because during EHV we couldn't find landlords, and Keenan has like a database now of how many landlords how many units have you found?
Since September, we probably have 150 units that we've had on the books at one time.
Yeah, so we have 150 units just sitting out there that are the landlords are homeless friendly, and Kenya's spoken with them, and we can't match them to a voucher right now. So that's part of the reason why we have this TLS program, is because, you know, we don't have EHVs anymore, unfortunately. And so we need additional income subsidies to get 150 units filled.
Exactly. And so, yeah, just to clarify the roles, like this is really just a reimbursement program. So we're providing a financial backstop for our providers in the field to expand their existing TLS programs. You know, because of my position in housing location, I can help inform with housing leads, you know, inform our case management TLS teams of housing leads that we see coming available. But really, we want this to function like a conventional TLS program where the service provider, our providers out in the field, are still the program administrators, and they're doing the liaison, you know, with the tenant and the landlord to check on the housing plan. And what that looks like just actively over time is, you know, that expectation that there's that repeated housing retention engagement. So case managers are going to visit the tenants once a month and work on all those great things like evaluating the housing plan, getting folks document ready, benefits, you know, evaluating progress towards employment, and then looking at other things like, you know, if there's an opportunity to boost credit, to work on budgeting, things like that. So yeah, that's what we expect. And we're definitely here to provide, you know, any sort of advising, but we really expect this to just boost the existing programs that our partners have been doing really well in the field. So we're going to get that MOU out soon, to anyone who's interested. And yeah, I'm here to answer any questions.
Yeah, so the MOU is ready. And so this is be for any nonprofit or city that currently has case management, and they have people that are housing ready, and they kind of, you know, they have a housing plan to maintain self-sufficiency within 1 year. So yeah, if you would like to take a look at our MOU and you think your organization is ready for this, let us know and we'll send you the MOU, and then we can get you guys started. We don't have too many slots, so first come, first serve. A couple of really interesting other innovations we hope to do with this pilot program is we hope to work with our housing agencies. I think Julia Smith is on the phone, but from the Torrance Housing Agency. But the idea is that once we get people into TLS, let's see if we can swap them out with a voucher. And then also Shannon Murray from WLCAC, she's been helping me behind the scenes too, to kind of also put in a shallow subsidy swap out too. And a shallow subsidy can last for up to 5 years. So yeah, I think, and then it sounds like Hopix has our shallow subsidy program now going forward, and so we are looking to partner with them to do that kind of innovation. So really excited about those things. Cool. And then so Madeline, I think I hopefully that answered your questions. Yeah, Harbor Interfaith, St. Margaret Center can definitely get an MOU and get you guys signed up. Let's see, we had a question from Janet. Would this work for students experiencing a housing crisis? I think the answer to that, Janet, would be like if the student can be self-sufficient, like maybe they have some financial aid coming that just isn't here yet, then yeah, that would work. Like we can then swap out the TLS with their financial aid and get them housed right away. Sherry had a question. Can these funds be used for rooms for rent as long as the rental agreement can be provided? I think if I'm understanding that correctly, yes. Like,
yeah,
the idea would be that like Harbor or someone would go ahead and lease up the person, and then we would reimburse the agency for the rental agreement. Hopefully that answers the question. If not, feel free to chime in. And yes, we don't, the beauty of any COG program is that we don't have, we're not beholden to any system. We can be flexible to families, individuals, TAs, whomever needs it.
Yeah, Ronson, I was just referencing like shared housing where maybe the only thing that they could afford is a room for rent, but they would be provided an agreement.
Oh, I see, a room for rent. Got it. Yeah. Yeah. Yeah, definitely. And then we also do that with client aid, for a limited time, because the rooms for rent actually qualify under our client aid maximum reimbursements. So we can also tap into client aid if TLS isn't suitable for it. So there's that as well. And we've done that too. All right. Any other questions? Can you stop sharing? Let's see if there's any other questions. Yeah. Okay. Okay, cool. Great. So I guess that's that for that topic. Thanks everyone. Wani?
Okay, yeah, thanks. Keenan's doing a really great job for us, and we're just glad he's part of our team. So just keep up the great work, Keenan. And then I'm going to turn it over to Ronson because he's got the summary of the second executive committee meeting. Go ahead, Ronson.
Okay. So yeah, just sharing my screen really quickly. For those who don't know yet, this is the executive committee on regional homeless alignment. And this body was formed out of the Blue Ribbon Commission to sort of coordinate and provide some accountability for the homelessness systems throughout the county. The second meeting was held last week on 4/24. There's 9 members. 8 of the 9 members showed up. One member is no longer part of it because he unfortunately didn't win re-election, so he's no longer on the committee. But it's 4 cities, and our representation is Paige Keller-Jurvik, a council member for Redondo Beach. She's representing the Southwest sector. That also includes the West Side, Santa Monica, West Hollywood, and Beverly Hills, and those folks as well. And then there's 2 county supervisors, Barger and Horvath. Mayor Bass was actually there representing LA City along with council member Rahman. And then we also had a state Newsom's I can't remember her name, but there's a state representative as well. The discussion on this second meeting was to discuss the bylaws, which states that the idea is to develop one plan and drive one effort regionally. And there was some discussion on how to do one plan, since the region is very diverse. And I think the idea is to bubble up regional solutions into one effort. And that was kind of part of the discussion. To establish a common set of performance indicators and make collective decisions on the best available data. So there's a focus on data. I know that's been somewhat lacking. A lot of our cities don't know inflow and outflow, and the demographic characteristics of the homeless population. And so we're hoping to see that improve through this executive body. And then to align funding and resources within each member's respective jurisdiction or area of influence. So, a lot of what came out of Birch was that, hey, the cities wanted to do more. And in turn, they're looking for more funding to do more and be more active and be more accountable to the homelessness crisis. And that's really what that third bullet is really all about. And then there was a discussion on the leadership roundtable. This leadership roundtable is going to support the efforts of the executive committee. And the leadership roundtable is made up of different departments in LA County and agencies, as well as people from the community leaders from academia, business community, the faith community, labor, veterans, lived experience, and service providers. And so, and so they're looking to fill 19 seats. They had 50 applicants. We submitted 3 applicants of our own, just people that we've partnered with in the past. One from the faith community, and then 2 from the business community. So we're hopeful that we can get 1 or 2 people on this leadership roundtable. And so that's the update there on the executive committee. They're going to do once a month meetings. The next one, I believe, is May 24th, if I remember it correctly. But I'll send that out in the meeting notes as well.
Okay, thanks, Ronson. Any questions for Ronson on that? No? Okay, so we'll go to our legislative updates. So if we have any of our partners that have any information, state, federal? No? Thought I saw.
Hi, Janet Turner.
Yeah, hi, Janet. Go ahead.
There it goes. the Congressman did introduce a homelessness prevention act, and we're going to just see how it goes through. This particular act would provide grants for low-income families to pay unexpected costs, like the big electric bill, things that often will send a very low-income family over the edge into homelessness. So we're going to follow that and see how that goes. That's about all from us.
Great. And thank the Congressman for attending our General Assembly. He was well received. Anybody else for legislative updates?
This isn't really a legislative update, but I just wanted to let everyone know too, there is now a SPOT 8 representative on the LAHSA Commission. Supervisor Hahn appointed Amber Ginsburg. Actually, Amber Seek. I'm sorry, that was Amber Seek's her maiden name. Amber Seek to the commission, and we're really excited. Amber's been a great partner in CD15. Has taken leadership of that homeless working group. Lori Jacobs knows her well. In fact, Amber was the one that nominated Lori Jacobs to be Woman of the Year at San Pedro last year. So Amber's a great partner and friend, and we're very happy that she's serving and representing us. If you guys have any questions, comments, opinions, or anything like that about her role on the LAHSA Commission, or want to send her a message, let me know, and we can maybe convey that over to her. And yeah.
Okay. And I haven't seen any other hands, so we're going to move on to the COG. Jackie, are you there for us?
I'm sorry, I couldn't get my cursor over there to unmute myself.
Hi, Jackie.
Hi. I don't really have, I think we had an incredibly successful General Assembly. In no small way were we not helped by Ted Lieu, who did a fantastic job. And I've gotten a lot of feedback about that and him. So we're recovering from that and working full speed on a lot of other programs. I'm Ronson, unless you can help me, I don't think there's anything that really is absolutely on point that you haven't heard already about our homeless services programs. We are working on the local travel network and senior services and energy efficiency, and we're working more closely with our school districts, but I don't think there's any special announcements I need to make.
We did interview for the project coordinator position this past week, had a number of interviews, got some great candidates. So knock on wood, I'm hoping to be able to announce Jan's replacement soon. And yeah, that's very exciting. And yeah, very excited about that.
Yeah, I was scared to jinx it, so I didn't say anything.
Okay, well, thank you, Jackie. Good to see you again. Anybody have any announcements that they want to make? Jonathan?
Sorry, that was just applause for the
Okay. Any other announcements from anybody from the group?
Hi, everyone. Bronson, I didn't raise my hand. I apologize.
Go ahead.
Our Bridge of Hope Community Housing Pallet Shelter in Hawthorne will be celebrating our 1-year anniversary May 15 from 9 to 12. So I'll send out a flyer, Ronson, over to you, and you could share. Everyone welcome.
Wow, it's been a year already.
A year, and we opened May 15 of 2023, and we're celebrating exactly May 15 of this year. So I'm looking forward to it. Time flies.
Mm-hmm. Awesome.
Okay, Ronson, do you have something to say?
No, I was just clapping.
Okay, just clapping. Okay. All right, anybody else? Okay, I'm really glad that we had this conversation at the beginning of the meeting about the family system. So I hope everybody works really hard on this family system to make it to gel. And with that, mark your calendars for the next meeting, which would be 3 July. And we hope you guys all have a great Cinco de Mayo, and we won't see each other, but happy Mother's Day to all the mothers. So with that, we stand adjourned. Thank you.
Thank you, Rodney. Thank you, everybody.